I do want to say that there's basically three ways to reperfuse the heart. That is to restore proper blood flow to the heart. And that is the key to success. I mean, that's what saves lives is identifying patients who have blockages and fixing them. There's three ways to fix it. Right now, there's coronary artery bypass surgery, which I said is in it's kind of in a decline, but does work very effectively. There's stenting, which is a catheter-based technique in which we put a stent in there.
To open it up.
Yeah, it looks like a little fence. It's a nickel platinum structure that's round and it pops open. And these also have some medication on them that locally help prevent the spread of the disease. And then there's a third technique. Okay, there's a third technique, which is a safe, simple outpatient technique called external enhanced counterpulsation. Now, EECP is a 1 hour treatment that you get every day for 5 days a week for about 6 weeks. And what it does is it pumps your legs from the ankles up while the heart is relaxing, and that pumps, increases the pressure in the artery supplying blood to your heart and stimulates them to grow. It stimulates new vasculature, neovascularization to occur in a very global fashion. Now, the interesting thing about bypass and stenting is you can only fix a blockage that's in the biggest area of the artery. It has to be 2 millimeters in diameter or greater in that area. But if you look at the anatomy of the heart, you've got thousands of little vessels that are less than 1 millimeter, literally probably tens of thousands of them, right down to the capillary level. And the EECP is able to open up arteries in a more global fashion at the smaller microscopic level. And so it's a really cool therapy. Interestingly, that therapy is approved by Medicare and most insurances, and it's also scientifically proven to work.
So this isn't just experimental, because you rarely hear about this therapy. Is it experimental or it's?
It's not experimental. It's been highly studied, and it's been shown to be of value. It's approved by insurances. At one point in time, when it first got approved, say 20 years ago, the payments were really high, and it was kind of a money winner for the doctor. And since then, it's been cut, and now you actually lose money if you have EECP in your office. I mean, you can't, because the equipment is expensive, the machine's expensive, and you have to have a technician and space and all these sort of things. So no physician can make money by prescribing EECP. It's a loser to them financially. So it's virtually, you can never find it. We're probably the only group in Orange County that offers it. And then I had a patient who lives in San Pedro, and he was like, gee, doc, I don't want to drive all the way to Orange every day. Can't we find it around here in San Pedro somewhere? And I was like, well, let's call around. We were unable to find it in San Pedro because, again, it's a lost leader for any practice that's doing it. And
who are the patients that are candidates for this? Is this cardiomyopathy patients, or is this just diffuse coronary artery disease?
It's actually been shown to improve blood flow to your heart in patients with severe coronary artery disease, but it's also been shown to improve functional capacity in patients with heart failure. So it's indicated for both sets of patients. I think it's a more powerful tool in the patients with severe coronary disease. And I think that people who are employing it routinely today often use it for patients who are not amenable to revascularization with bypass or stent. But I think it should be probably, the indications could be widened to almost all patients with coronary disease.